From there, the increasing burden of non-communicable diseases, NCD, hypertension, and diabetes in Nigeria has sparked a call for action from health experts and advocates. The Executive Director of Corporate Accountability and Public Participation Africa, CAPA, emphasizes the need for a more effective tax policy to promote public health and reduce the burden of NCDs. Olufemi advocates a tax increase to 130 naira per liter, citing global best practices and World Health Organization WHO guidelines.
Journey for what we call food justice in Nigeria. So CAPA has been campaigning for healthy food, be it when we did the transfer campaign, of recently the salt targets, and then the SSB tax campaign. We cannot thank you enough, media partners. In fact, I was in case you don't know, there were a few people here that were working at possibly to expect this hotel from the presidency. And immediately we mentioned CAPA. I said, yes, we will have an event last week. Apparently, almost everybody that either watches the news or read the newspaper or online seems to know one or two things about us, thanks to what we're doing.
Okay, Joseph Ekiyo, a health expert, warned that regular consumption of sugary drinks can increase the risk of hypertension, diabetes, cardiovascular diseases, obesity, and cancer.
The laxity or the reluctance of the government to really take the bull by the horn, that is one. Secondly is the industry narratives. You know, these also have their narrative that if you have a tax on SSBs, there is going to be loss of jobs, there is going to be this and that. But we've asked, okay, let's take for instance, the highest employing industries in Nigeria. First 10, first 20, I can tell you, you won't find one single SSB industry here. Most of these industries are highly mechanized or automated. And what they do is, when they count the number of employees that will lose whatever, sometimes they count their bulky man along the road as part of their employees. But the truth is that there is none of those even that did this solely on SSB. And long story cut short,
the experts agreed that the SSB tax is not a burden, but a shield for the most vulnerable and an opportunity for Nigeria to address its public health care challenges.